Illinois has lifted restrictions on abortions in recent years, but other limits on health care and reproductive care specifically remain. Amanda Vinicky joins us now with more on a new law that seeks to change that. Amanda.
Yeah, Paris, birth control is basic health care. So says Katie Thiede. She is the co-founder and director of Illinois Contraceptive Access Now, or ICANN. Birth control obviously used to prevent pregnancy, but she says it has other purposes as well. For example, it can be used to control medical conditions. Even so, it's not always easy for everyone to access.
1 in 3 women has struggled to access birth control during the pandemic due to health centers' limited telehealth infrastructure. For Black and Hispanic women in particular, distrust of the healthcare system due to experiences of discrimination, racism, and/or contraceptive coercion remain a barrier to care. And here in Illinois, 800,000 women aged 15 to 44 with fewer resources live in counties where there are no health centers that offer the full range of contraceptive methods.
Among the barriers, until this month, Illinois required a doctor to prescribe birth control. Not going forward, a new law allows a pharmacist to dispense up to a year's worth of hormonal contraception or self-administered birth control without a prescription from a doctor. But it is not quite over the counter. A trained pharmacist has to have an agreement with a doctor for oversight. The patient must also undergo an evaluation with the pharmacist, and that private counseling could lead the pharmacist to send a patient to a physician. Could be for something like an IUD, could be for other medical intervention. Head of the State Pharmacists Association, which helped to advocate for this law, says that the pandemic has shown the expanded role pharmacists can play in a strained healthcare system.
COVID has definitely helped the country see that pharmacists are a point of access for medical services as well for some. Now, I won't say all because we're not a doctor, we never will be a physician, but we can help with alleviating a lot of the ancillary patient care services, like we've been able to do with point of care testing, specifically with COVID testing, how we've been able to continue to expand with offering vaccinations.
ICANN's other founder, certified nurse midwife Kai Tao, says these consultations will also provide pharmacists with other opportunities for medical intervention.
It is a great way for somebody who may not access care otherwise to find a trusted provider, get the birth control they need, but then also be bridged to a primary care provider. Because I do want to mention about sexually transmitted infections and the importance of making sure that the pharmacist is also assessing that, right? They should never be withholding it, but then they're also saying, and this is a great place to get tested, including HIV, gonorrhea, and chlamydia, which, in Illinois, historically, we've always had very high prevalence rates.
She says a pharmacist also will be required to check a patient's blood pressure, and that's another opportunity for a health check. But director of the American Life League, Jim Sedlick, says that pharmacists don't have time for thorough consults.
It's a disservice to the women who are looking to get the hormonal birth control, because there are so many dangerous things about the hormonal birth control. And when you go into a doctor's office and you ask the doctor about it, they generally have the time to talk to you and to explain the problems, to explain the fact that the hormonal birth control causes deep vein thrombosis, blood clots that could cause heart attacks or brain aneurysms or pulmonary embolisms.
Sedlick is also concerned that Illinois' new law sets no qualifying minimum age.
A 13-year-old girl, a 12-year-old girl could go into a pharmacist and say, I want the birth control, and can get the prescription if they fill out the paperwork. And unfortunately, they're not adults yet, and they can't make the decisions the way that they should be making the decisions.
He says teens' cognitive thinking just isn't developed enough for them to make long-term choices about their health. But Tao says birth control is safe.
Usually it's a progesterone and an estrogen. And in general, there is a lot of discussion, even globally, about this campaign called Free the Pill, which says that campaign is really about why can't birth control, like in many other countries, you may see it truly over the counter without a prescription. there's a lot of arguments when you think about something like acetaminophen, like a Tylenol. Is that even more dangerous than what could happen if someone took the pill inadvertently, right?
She says that other states have shown that this is safe. Some 17 have a similar law already in effect. Now, even though Illinois' law has been on the books, technically taking effect at the start of this month, it is going to take some time before patients will be able to bypass a doctor in order to access hormonal birth control. There's red tape to go through, federal approval in order for Medicaid recipients to be able to go this path, and then also training that has to happen, as well as practical matters like pharmacies that the head of the state association admits are struggling with staffing, as with so many other industries, as they get up to speed, decide, for example, whether they're going to take walk-up appointments or whether they will require them to be scheduled. It is expected that those with government-backed health insurance will, however, be able to go this route within the next several months. It will be until 2023, however, that those with private insurance will have it required through their insurers. Now, Paris, back to you.
All right, still a ways to go here, Amanda. Thanks very much.